quick procedures, prominent scarring, repeated revisions to correct or improve past surgeries, and complete distrust of the medical system. These are all experiences that patients of Jackson-based facial plastic surgeon Dr. Adair Blackledge shared with Mississippi Today. Our reporting uncovered an often unknown reality in the world of medicine. There are few requirements for doctors to practice facial plastic surgery. Dr. Blackledge is a well-known facial plastic surgeon who has practiced in the Jackson area for 22 years. According to Dr. Blackledge, he has performed 12,000 facelifts and rhinoplasties, a pace of 2 procedures per day in his career. Patient records show that procedures, including facelifts, were performed in under an hour and a half. In one case, a facelift and a rhinoplasty were performed in 65 minutes. 4 board-certified plastic surgeons told Mississippi Today it takes the average plastic surgeon 4 to 5 hours to perform a facelift. They spoke generally and did not comment on Blackledge's practice. He has not faced any public disciplinary action by the Mississippi Board of Medical Licensure, the state agency that licenses and regulates physicians, and he hasn't been sued for his work. Many patients cited positive reviews on social media and affordability as reasons they went to see Dr. Blackledge. They also cited his bedside manner and availability after surgery. Blackledge said he believes the care he provided to the patients interviewed for this story met the standard of care expected of a facial plastic surgeon. All the patients interviewed for this story signed medical consent forms, and Blackledge emphasized that these experiences only represent a small portion of his patient population. One patient told Mississippi Today she experienced incisions in places she didn't expect and debilitating scars after a facelift. Instead of a few stitches hidden in her hairline and others placed behind her ears, the incision draped about an inch below her hairline, and there were more staples than she expected. She has since stopped wearing her hair up, didn't go to the gym for a year and a half out of embarrassment, and struggles with anxiety following the procedure. Blackledge said her scars show an extremely reasonable result, and he emphasized that there is no way to prevent scars after surgery. Another patient who traveled from Missouri underwent surgery to slim her nose with Dr. Blackledge. After the procedure, her nose was fuller than she hoped, but Blackledge offered to revise it for free. After revision, her nose became red and swollen, and she occasionally caught whiffs of a foul odor. She said she felt chronically fatigued and depressed. An abscess in her nose burst 3 years later, leaving an indentation at the tip of her nose. It smelled like death, she said. Multiple doctor's appointments revealed she had a chronic infection in her nose. Dr. Blackledge said every surgical procedure carries the risk of infection and isn't proof of inappropriate care. Another patient from Mississippi noticed her face drop 1 month after her procedure with Dr. Blackledge. A string of revision surgeries took place over 2 years, but they came with their own problems. Stitches repeatedly popped out, leaving incisions gaping open. It was difficult for her to explain why she kept returning. She told Mississippi Today she felt vulnerable. Scores of alleged patients of Blackledge have turned to social media to share their stories in a Facebook group. Some patients said social media made them feel less alone, and they encouraged one another to make formal complaints to the Mississippi Board of Medical Licensure. One said she was interviewed by the board, but others told Mississippi Today that their complaints were dismissed or ignored. The board declined to comment, citing its policy not to comment on pending investigations. In Mississippi, there are few requirements for doctors to practice facial plastic surgery. Licensed physicians can practice any specialty field, though some choose to be board certified to demonstrate their experience and expertise. Dr. Blackledge is not board certified in any specialty field. Experts told Mississippi Today that many hospitals and insurance companies require board certification, but fewer regulations apply for surgeons who operate in private offices. This leaves patients to decipher a complicated world of medical certifications on their own. You can read the full story at MississippiToday.org.